Thank you so much, Angie. And thank you so much for our speakers. This really is a very interesting topic. And just a few reminders for the next half of the session for our speakers. I know that there's so much information that you can share, but please be mindful of the time just so we can keep our audience as well. I'm sure some of them might have other appointments later on. So let's move on to our next speaker. So the first few for first three speakers, they've really tackled about how to model and how to visualize the information with regards to the infected population. But our next lineup of speakers would discuss other aspects of this particular pandemic. And let's begin with our next talk entitled Reflecting on the Potential Economic Effects of Lockdown in the Philippines Due to COVID-19, Lessening the Impact on the Poor. Our speaker is a full professor and the dean of the School of Economics at the De La Salle University in Manila, Philippines. And her research work focuses on human capital development, poverty and inequality, and on the economics of agricultural development. Without further ado, let us welcome Dr. Marites Tiangco. Dr. Tess, you may now begin sharing your slide.
Thank you so much, Dr. K. So are you seeing my slide?
Yes, we can see it.
So I apologize if you can't see me on video because I'm trying to uh, what's this to maximize the use of the internet. Okay, sorry. I think it should be the first one. Okay. So good morning or good evening wherever you are in the globe, and thank you again for the wonderful introduction, Dr. K. Aviso, and to the Philippine-American Academy of Science and Engineering Society for Climate and Disaster Resilience for inviting us in this special session on COVID-19. So I'm going to talk about reflecting on the potential economic and effects of lockdown in the Philippines due to COVID-19. I'd just like to acknowledge my co-authors here for this research work. So Cesar Coloraton, he is a visiting fellow of De La Salle University and at the same time a senior research fellow at the Global Issues Initiative Institute for Society, Culture, and Environment at Virginia Tech in the US. And Dr. Arlene Inocencio is our full professor and chair of the economics department of the School of Economics. So let me just show you this slide, which I showed like a few months ago, right after the lockdown, like 20 days after the ECQ in Luzon. So about that time, I presented this projection on GDP growth showing a V or a stretch V-shaped recovery. This was, of course, assuming we will have a quick recovery in the economy, assuming that we will all cooperate and work together to slow the transmission and that no reemergence of the virus. So there's the economic downturn. Downturn is actually very deep dive here, and then there'll be a recovery right after, a rapid recovery after. But after 3 months of the enhanced community quarantine that was lifted on June 30, 2020, the government started to ease out lockdowns and gradually reopen the economy in Metro Manila and the whole of Luzon. And after that, uh, allowing people to return to work. So I would guess a more stretched U-shaped recovery might be achievable. And that would mean like it could stretch out until 2025 to 2026 before the economy really recovers to its former output level. Now, let me just say that the forecast path shown here does not really take into account the effects of reallocation of resources that the pandemic has brought about, especially in the labor market. So we all know that there has been an increase in unemployment already, which is around 17.7% productivity losses, labor reallocations, and negative business and consumer confidence growth. And there's also some falling savings. Okay, so now you've seen this already earlier in one of the presentations by Mr. Robert Neal, and I'm just going to show you that this again, just to show you some data on confirmed cases and estimated date of infection. And as you see that R naught, or Mr. Robert Neal Young calls it RT, that it's hasn't really been down to my to below one. The goal is, of course, to get it back to below one, and that also the goal for he also mentioned earlier that we have already reached the 80,000 threshold. In fact, within a week, just this week, last week, we are the first in the ASEAN, among ASEAN countries, who reached the 50,000 threshold of incidents. And so, of course, our goal is to get it back to below 5%, because that's the positivity, but that's the accepted value of positivity rate by WHO. But then how can we, if we are reopening the economy gradually? Okay, this to show you that we weren't really prepared at the beginning when COVID-19 pandemic has stricken us. So our Philippine system was fragmented. There was the healthcare in the Philippines, and then pandemic only highlighted how ill-equipped the country is in dealing with disasters such as COVID-19. In terms of the emergency responses, so we had to balance public health priorities with economic and social activity, accommodating short-term measures to mitigate the spread of the virus. So what we did was to implementation of non-pharmaceutical, and this include investing in telecommunications, health innovations, and financial protection. Okay, so government so far has done centralization of response through the place to IATF, or the task force. LGUs were also given the um, also were given the power to enact ordinances and implement quarantine and provide guidelines for some health messages, implementing quarantine, isolating areas, and distribution of cash and non-cash assistance. There was also realignment of funding, and most importantly, social distancing measures, the congestion and restrictions on social activity and movement to reduce transmission and in turn reduce demand for health care. So there was prohibition of mass gatherings, restrictions of movement, including restrictions of air, land, sea, transportation, and public transportation, air transportation, sorry, and public transportation. And restriction of commerce, which really affected our economy. uh, so there was limitation of business establishments and the establishment operations, and closure of establishments like malls, places of amusements, and hotels. So tourism was sector was very much affected. So all of these measures were called Bayanihan 1. And now because this is like the lockdown was actually the uh, being the key response to reduce transmission of of COVID-19. So I'm going to talk about the potential economic effects of lockdown, which this work actually was done way back in April 6, 2020. That was 20 days after the enhanced community quarantine was implemented. So our work has been cited already by the government agencies like Department of finance, and BSP. And so, just to give you um, a brief note of what the methodology we used. So we used the Philippine Computable General Equilibrium Model, and it was calibrated to 2018 Social Accounting Matrix with 214 sectors. And we used also Philippine Poverty Microsimulation Model to estimate the potential effects of lockdowns in Luzon and the Philippines to estimate the poverty effects. So what we did was for 1 month to 3 months, the scenarios were 1 month to 3 months, and compared it with the baseline scenario of no lockdown, which is 1 full year of no disruptions. And we used the GDP of 2019 as baseline. The model was also simulated by reducing the labor efficiency parameter in the 1 to 0.75 depending on the coverage of lockdown. So if it is Luzon, 70% of total Philippine GDP, and if it is with an adjustment of 0.825 adjustment factor for labor, and if it's entire Philippines, 0.75 adjustment factor. So these scenarios captured lockdown factors affecting labor efficiency, such as labor conditions, and the reductions in labor efficiencies that would result in corresponding reductions in outputs. Okay, so this will just this slide shows you the possible effects of the enhanced community quarantine in the Philippines. So it's entire Philippines, and it's almost the same also as for Luzon because, as I said earlier, 70% of GDP is contributed by Luzon. So this scenario is when the lockdown is for 3 months. So that was actually until June 15, 2020, and the economy contracted by 817 billion, which is approximately 16.5 billion US dollars, and relative to the 2020 projected level, and relative to the 2019 GDP, which was 356.8 billion US dollars, with a growth rate of 5.9 or 6% growth rate, the economy contracted by 2.4%. There were 8 sectors much affected for this lockdown, and the top sectors were garments, computer related, in the industry like the BPOs, and then construction, agriculture, and other manufacturers. So the government budget deficit increased to 3.5%, while prices increased by 8.8%. So the impact of the poorest group is the largest under the scenario, and the income inequality here actually decreased as well. So support also should has been targeted to vulnerable labor groups in critical sectors, and it should actually quickly restore labor conditions affecting labor efficiency. The social amelioration program that gave additional support to the poor by 5,000 to 8,000 in May and June were in the right direction. So sorry, nag-stuck yung laptop ko there. uh, in terms of the effect on the poorest household, so the poorest household groups are the most vulnerable to the COVID-19 pandemic, and combined with the lockdown, it could drive absolute poverty down. So actually, to reverse the negative effect of the 3-month lockdown, an additional 70 billion pesos, or equivalent to 1.4 billion US dollars, is required to reverse the change in all poverty indicators that you are seeing in the slides. And so the poverty effects are progressive in the sense that the poorest group, as indicated by the poverty gap of negative 2.2, has the highest poverty reduction. Noteworthy is the poverty severity that is high as negative 2.7, which captures the degree of inequality among the poor on the distribution. However, this additional budget increases the deficit gap uh, the deficit gap per GDP to negative 3.6% and also increases the price by 9.2%. These effects can be mitigated with the most recent launching of the nation's largest and widest social protection program, amounting to 200 billion pesos. That's the second wave of the SAP. This amount could cover actually the most of the poor in the society, and it also includes the support to improvement of the health facilities and health service delivery in the country. Okay, so let me now go to the I already mentioned about the policy recommendations there. So let me now move on to way forward. So we recommend that there should be a resumption in aggressive spending in infrastructure through build program and continue the reforms on taxes and incentives. I would just like to show you the what we worked on before the lockdown or before the COVID-19 pandemic. We did we did uh, an estimate or simulation of how would the corporate tax reduction affect and also reducing the fiscal incentives. So actually the the corporate tax, the corporate income tax is a major source of government income. And then we recommended that there should be a gradual reduction in corporate tax within 10 years from 30% to 20% starting 2020. And this gradual reduction would also be um, coupled with fiscal incentives reduction over the same period. So if you notice here, there's 47.7% of the total income tax revenue of the government that could be accounted for corporate income in 2018. So the assumption that the money incurred from incentives will be taken out from incentives, and this will be declared as dividend, not as additional income of the household, but should be reinvested to the system as investment, additional capital stock. With the economy that is assumed to be growing, it can be justified that there is opportunity to earn money as money flows back to the economy through investments. So if we reduce the corporate income tax, there will be government deficit, then increase inflation, increase interest rate. So the potential impact of reduction of the corporate income tax will be minimized because of the higher deficit. The challenge is how to finance the expected increase in deficit as a result of the reduced corporate income tax. Take note that the fiscal incentive given in 2017 amounted to 322 billion, and this can be used actually to uh, support the deficit. Okay. The potential effects we found out when there's gradual reduction of CIT for the next 10 years was that the macroeconomic and employment effects are and also on poverty and income distribution. The same model that we used was the CGE model and poverty and microsimulation analysis. The effect of tax reform package is actually growth promoting on employment. The poverty effects are actually shown there, and says that poverty incidence increases during the initial years of government deficit, and it will deteriorate later. Poverty incidence declines slightly toward the later years. The decline is sustained if corporate income tax, again, is, as I mentioned earlier, fully reinvested back into the economy. However, if the increase in corporate income tax is declared as dividend income of households, the trend is in poverty reverses from late later years like 2026 to 2029. I can't, oh, okay, my cursor is working, so this part here. So some policy insights from this one is that the corporate income tax is a major source of government revenue. Reduction in current rate from 30% to 20% in 10 years will result in sizable government deficit. But if the reduction can be invested back to the economy, it will be growth promoting, employment generating, and poverty reducing. And there will be potential positive effects on sectoral incentives also are reduced if the improvement in corporate income tax is not fully reinvested back into the economy. This means that if there are other sectors that don't really invest fully back to the economy, then there will be deficit as well. So now, well, with the COVID-19, the government has actually um, calibrated the Sitira, that was the name of the law that was supposed to be implemented earlier before the COVID-19. And so they calibrated it to create. Create means corporate recovery and tax incentives for enterprises. So this cuts corporate income tax immediately by 5%. So not the gradual one, that's 1 point reduction every year, but this one is 5% immediately in 2020, and no change in present incentives for the next 4 to 9 years, which means income losses of about 259.54 billion pesos until 2022. So just some, sorry, I'll just skip that one. Another upcoming reform or law that's being passed is the Bayanihan Act II. And this one is actually recover as one part two. And it's already in its second reading. And I think this one should be supported, given that the programs that are going to be implemented here will help the economy uh, propel. Like for example, there will be enhancement of the health system and support programs for private and public workers as well, and the Department of Agriculture assistance as well. So I think I will just stop there. Actually, the Bayanihan 2 on the expenditure side will help restore incomes and jobs of consumers. And again, this will stimulate private consumption. So it is important to restore the confidence of the society to go out and spend like they used to. We need more private consumption to stir up the economy. And also, firms' operations will be subsidized by Bayanihan 2, and the recovery will probably be faster if it's going to happen. Like there will be micro and small enterprises subsidies for them, and for them to be able to comply with the health and safety protocols like physical distancing, regular disinfecting premises, and others. So I guess I would stop here, and I think I've consumed all my time. So I'll just take questions later on. Thank you very much.
Thank you very much, Dr. Tess. So we'll take the questions after all the speakers have completed their presentations. So our next speaker will talk about transdisciplinary and transsystemic interdependencies for effective pandemic prevention and management. Our speaker was formerly the ASEAN Regional Coordinator for Multisectoral Pandemic Preparedness and Response. He is a consultant for emerging pandemic threats such as the Ebola, and he has been involved in whole of society pandemic preparedness and response. One Health and Continuity Operations Planning and WHO, EDB, EUEC, and IFRC projects. He has over 35 years of work experience in the fields of microbiology, virology, transgenics, public health, infectious and zoonotic disease diagnostics, epidemiology, prevention, and control. He is engaged in various COVID-19 pandemic response efforts as member of expert peer group contributing both technical and policy recommendations. Let us welcome Mr. Noel Miranda. Well, I think you're still on mute. So,
Hello, hello.
all right, now
All
we can
right,
hear you.
sorry. Yes. Good morning, and of course, my presentation is actually touching on not so much the science this time, but of course the art. And I appreciate the presentation that actually was given before mine. And this would actually make it easier for us to understand what transdisciplinary and transsystemic interdependencies is actually focused on. So, oh, my slide is not moving. Sorry.
Can you try clicking on the arrow keys
Okay,
at the
there you
bottom?
go.
Okay, there you go.
So, transdisciplinary, in this case, I would like to define it as something that's integrated process that synthesizes links and extends discipline-specific approaches to generate new models for solving cross-cutting problems together. Okay, so the word "together" here is very important, and as you can see in the illustration, how transdisciplinary is illustrated versus disciplinary and multidisciplinary and interdisciplinary. And in fact, this illustration actually came from K to 12 school, which is actually focusing on transdisciplinary learning. And I'd like to emphasize that transdisciplinary is not jack of all trades, but rather it's a person who recognizes the limits of his own trade and integrates other inputs to attain synergy. Now, being a transdisciplinarian is like an essential ingredient in a gourmet dish, where each ingredient focuses on making of the gourmet dish, and not just on being the most essential ingredient. To attain this state requires a gourmet chef who understands well his ingredients and sees the value in all. So this is a bit philosophical, and you can ask me, can we make this a reality? Well, I would probably continue with my presentation and we can all decide together. Now, one resilience unitive model, which is part of my title, actually means it's the advocacy for us to think and work as one. And all should ask, what concern of mine is also your concern? And what concern of yours is also my concern? And this is discipline and sector domain should naturally support and depend on each other. How do domains provide cross-cutting support? So that's the big question. So this is really talking about the unity of humanity in mind and action. And in this real world, we are actually, so much diseases are lurking. And these are actually driven, by disaster, climate change, land use change, wildlife trafficking, market trades, trade activities, food and water insecurity, extraction, pollution, global, and so on. And poverty here, I capitalize poverty because this is really something that's driving so many things. And you can see in this illustration as well that poverty is central, which is actually influenced by social barriers, stigma, illiteracy, lack of awareness, food insecurity, and so on and so forth. And and here, my topic's actually on prevention as well as on managing the pandemic. And I'd like to talk about a bit about prevention, which is really focusing on the spillover of diseases. You've heard this over and over again, that the SARS coronavirus 2 actually spilled from animals. The bats and the pangolins are actually implicated. And for spillover to occur, you have to have these small circles or holes to actually line up together. To actually, so the probability of spillover is so small, considering the so many variables that you have to line up for spillover to occur. And this is a very good illustration of how spillover from wild animals going into domestic animals and going into the human population. Now, I'm a member of the World Veterinary Association One Health uh, uh, group. And so we have made these statements. One Health oversight under a common leadership is so important. That support early education is also important for One Health. and to address the social and industrial drivers of detrimental human behaviors, particularly poverty, and inequitable development and resource allocation. So here I made a problem-solving analysis showing to you the problem, the cause, as well as the effects. And particularly, I'd like to say, the separation of agencies and heads. The presentation a while ago talked about fragmentation. Now, discipline-specific approaches, issues. We kind of have silos, disciplinary silos. One silo worked on its own, so that's fragmentation. And so zoonosis prevention and control is actually divided among these disciplines: health, agriculture, environment. And so there would be slow response to emerging infectious diseases. There will be overlaps in program activities and unpreparedness for these outbreaks. So at the end, you have poor response to emerging pandemic threats. So this slide actually is borrowed from Shaheen et al., and it's really talking about the complexity of the causal loop diagram, which is represented here, where you have environment, economic factors, social, and they all kind of interrelate and impact on one another. I can't go through this, but I'd like you to refer to this publication if you want to understand this particular diagram. So here, again, I'd like to show you the problem analysis for beyond health pandemic response, which means this is focusing on the proper management of this pandemic that we're experiencing, COVID. Of course, again, it all boils down to fragmentation within these sectors and disciplines. And you have silos among these disciplines. And then pandemic impact mitigation divided among disciplines and systems: health, trade, economics, agriculture, etc., etc. So there will be slow response to outbreaks, haphazard response to health and non-health issues, continuing provision of essential services, for example, and unpreparedness for surges in cases, hospitalization and deaths, and social and economic impacts. So at the end of this, the effects of such fragmentation or siloed mentality would be poor response to severe pandemic impacts. That is health and beyond health. So here, back in 2016, there were actually a very important meeting where 29 countries actually gathered, and they reaffirmed the continued relevance of APSED. APSED is referring to the Asia-Pacific Strategy for Emerging Diseases under the IHR 2005. So this meeting that happened in 2016, almost 10 years, a decade after IHR and reaffirmation, where you have here Li Ailan saying that the Asia-Pacific region remains a hotspot for disease outbreaks and public health emergencies. Our shared vulnerability requires a collective effort to prepare for and respond to these threats. Okay, so that's a statement made, but really something went wrong. Okay, these core capacities that are supposed to be in place in most countries in Southeast in Asia have not and were not. So countries have not done intense preparedness and capacity building. We've shown that. So after 15 years of IHR, we've shown that we've not done this. And the Philippines in 2014 claimed that they have full compliance to APSED, pretty much close to full compliance in 2014. But this COVID pandemic apparently has proven that this is a little bit out of the tracks. So I did actually a survey in 2012 under pandemic preparedness and response assessments under ASEAN, and also under the Pandemic Preparedness and Response Project, where we did a lot of simulation exercises in the region. And this was supported by USAID. And the Philippines high-level coordination framework were actually identified, and that included the NDRRMC and the National Security Policy on disaster, crisis, and emerging infectious diseases. Actually, the national security policy has a statement which reads like this: in the face of pandemics and emerging infectious diseases, the government needs to define clear protocols and procedures to ensure continuity of essential services as well as business operations. So again, what did we do? Okay, given these structural framework or statements of policies, what have we done? Or where did we go wrong somewhere? So you can see that this actually illustrates how the structures should be cascading or transcending from a mild case of epidemic to a severe worst case scenario. And you can see the involvement of the non-health sectors becoming relevant as the pandemic actually become also more severe. And the lessons learned from the countries with all hazards framework is that most countries in ASEAN have an all hazard national interministerial coordinating body. Countries have high level coordination frameworks that can effectively activate their all hazard response systems. But apparently we made the wrong conclusions. And the key elements of multisectoral pandemic preparedness and response system are actually the following. We have identified this since 2013. Oversight and leadership, legislation and a clear mandate, budget and resources, comprehensive continuity of essential operations, policies and plans. Whole of community empowerment and participation, and of course, conducting regular simulation exercises to test your plans. So I also belong to a group called Pandemic Futures Initiative Groups, and we made an assessment just now for COVID-19, and this is what we concluded. COVID-19 responses are politicized, non-science driven. We require stronger whole of society coordination. As societies rush to relaunch their economies and design a more resilient future, we are overwhelmed with a plethora of approaches that are contradicting, disabling, and counterproductive. We see inefficiencies, poor interoperability, and avoidable knock-on impacts on both public health and the economy. And so this is the proposed Beyond Health pandemic risk management paradigm. Let's focus on health and socioeconomic resilience as one world community. And the mission really that we should be taking all together would be the setting up intersectoral pandemic coordination architecture within the UN system and also other regional and national frameworks. And we have to focus on harmonization of pandemic response guidance within and across sectors. So this is actually a very important model that I actually constructed sometime in 2013. And I tried to actually model this in the UP Los Baños to start a One Health education. And Professor Giselle Concepcion, who was then vice president of UP, actually enabled this meeting to happen. And we did discover that, in fact, interdisciplinary or transdisciplinary interdependencies can in fact happen, okay, can in fact be enhanced. But we need to go through a process of understanding the problems, the disciplinary solutions versus the problem, and identifying transdisciplinary collaborative solutions. I am a little bit sad because this did not push through, and there's actually no university in the Philippines that has taken up, transdisciplinary responses to all hazards, for example, not just pandemics, but emergencies. And there's really a need for higher education to kick in and drive the process of transdisciplinary and transsystemic interdependencies. So here is a model the Prepare project in 2009 to 2013 actually had worked on. This is the whole of society approach. We were actually the first to introduce this concept of whole of society. And the Philippines was among the beneficiaries of whole of society modeling. And unfortunately, we did realize that we need to do whole of society approach and work together, but there was just not any compelling reason until COVID came in. And this is actually a very good highlight of what the relationships may look like. We need to understand the needs of the sector. We need to understand how the sector can support government, the different private sectors particularly, how the sector cooperation mechanism can be designed or constructed, and the sector measures to maintain operations of individual actors and service providers. And all of these things put together will give you a sector linkages and interdependencies map or roadmap, and all the sectoral crisis response management structure would have been defined, and communication and cooperation mechanisms would have been defined. And this is my modeling, this came out in the publication of a chapter entitled Rabies Prevention in Asia. And this is the model of transdisciplinary, transsystemic interdependencies that I particularly advocate. You can see that health and well-being, together with ecological and industrial system, governance system, and social cultural system, would actually need to integrate, okay? But you need certain enabling conditions or enabling elements like integrative education, which I mentioned. Research and development has to drive this. And then also integrated management and communication. But all of the actors that are part of this would be government, the NGOs, civil society organizations, industry, and the academe. I always like to say that the academe plays a very important role. And so let me individually dissect this, giving you the wicked problem at the center, which is disease outbreak and risk vulnerabilities. And you have the causal elements as well as the impacts. Now, for health and well-being, for example, looking at this, what are the scientific expertise required? Of course, you need physicians, you need veterinarians, you need nurses, medical technologists, biotechnologists, pharmacists, public health workers, epidemiologists, all of those health-centric. But you also have the non-medical contributors to this, to the health and well-being of humanity. You have local leaders, you have police, you have food and water supply services, health product technologists, social scientists, community workers, educators, engineers, the military, and environmentalists. So we have to understand that, yes, there is a health system that we need, of course, health professionals to actually try to, manage. But the proper management of the health system cannot happen without the non-medical contributors. And this is the same for ecological and industrial system. We need scientific expertise, and we need the non-ecological industrial contributors. And also for governance, we have the governance system. We also there are expertise in the governance system, such as national local leaders, legislators, educators, communication specialists, logisticians, strategic planners, various technical experts, the military, police, social scientists, community organizers. But there are, again, contributors, which we have to include the medical professionals, the social workers, the engineers, industrialists, and environmentalists. And of course, this is for social-cultural system. Again, you have the direct contributors and, the scientific expertise, the direct contributors to the system of social-cultural system, as well as the non-direct or indirect. For the direct, of course, I'd like to emphasize that the economists are very important, anthropologists, human ecologists, communication specialists, urban planners, business managers, housing experts, gender experts, and of course, sociologists and community workers. And I have just two more slides, if you will allow me. So what are the considerations for Beyond Health? Beyond Health is actually equal to working together. So the question to us is, have we really achieved this end where we are actually working together? If this problem-solving model is not explicitly defined technically or philosophically, we cannot harness well-coordinated participation in action. We need to elaborate beyond health operationalization. The structures, framework, and leadership are important. And there is no clear beyond health operational model. At this time, we might not be able to get anywhere if we don't work on this model. So how does working together look like? Have we clearly defined the art and science behind this working together model? So to me, one resilience, or whatever you want to call it, is we need a unitive model or a unitive problem-solving model for attaining optimal health. Whether that's going to be something that will prevent the spillover of pathogens like COVID-19, or that will allow us to manage the worst case scenarios of this COVID-19 pandemic. So finally, my recommendations, and these are, I believe, are success factors. We need integrative leadership, of course. We cannot integrate without leadership. We need a mandate for this leadership, the policies and coordination plans and strategies. What makes one think integrated and be a good leader? We need higher education to create good leaders. We need people like, people on this Zoom call, on Zoom meeting. We need to drive this process of creating leaders. So remember that everything is governed by karma. Our actions or inactions today determine the good and the bad outcomes of tomorrow. COVID-19, of course, the determinants of success should have been set yesterday and not today. We failed to do certain things yesterday, and the outcome is what it is today. What can we still do today to save us from this COVID-19 disaster? Well, as the saying goes, we are, in fact, building the plane as best we can while we are also flying it. But the key here is really to build the plane as best we can, scientifically, methodically, unselfishly, in non-political ways, in more responsible ways, and for the common good. Transdisciplinary and trans-systemic interdependencies for effective pandemic prevention and management requires all of us to work together. Let's all collaborate to construct this working together problem-solving operational model. And this is really my call to everyone, not only in this call, but to the Philippines, to the world, to UN, to everybody involved in this fight against COVID-19. So thank you very much for.
Thank you very much, Noel. So again, we will be taking questions after our two more speakers.